Thank you, Mr. Chairman. Ms. Richards, thank you for your testimony. I'm going to try to take the emotion out of it and stick strictly to the numbers. Earlier you said you need to consider the source, so everything that I'll be quoting comes from Planned Parenthood. It is my understanding that 3%, according to your website and your testimony today, 3% of the services that Planned Parenthood offers are abortion services. Is that correct? 3%. Of your total services, 3%.
Sorry, my mic wasn't on. 3% of the services delivered, of the total services.
But yet you say that you don't have the total amount of money, you can't give this committee the total amount of money that's you make or receive for abortions. Is that correct?
It's because the national office doesn't, as you know, or may not know, but the national office doesn't provide health care services. 59 affiliates provide a variety of health care services, so that would be every single organization would be different.
But your affiliates gather that information, so you would have access to that.
Well, I'm sure they have it. I don't have it myself.
Okay, but how do you come up with the 3%? I do the math. 2.7 million people, 327,000 abortions. That comes up to 12%. So how do you get 3%? And these are your numbers. Why is it not 12%?
Well, because people come to us some people come to us more than once, and they come to us for different services, and some people come to us and they need a Pap smear, they need a variety of services.
Let's go on a little bit further, because I'm having a real trouble coming to this. And if you would put up the graph on, this is a tax return from one of your affiliates in Rochester, Syracuse region. If you could read for me line 2B. What does that say? What is the designation there?
Pregnancy termination.
Okay, and the dollar amount next to pregnancy termination there is how much?
Again, I've never seen this before, so I'm simply reading what you're asking me to read. 1,424,275. I'm assuming.
All right, so
and I think you're mixing services and revenue, because obviously the above line says family planning, 3,718,474.
but wouldn't you think the 3% is a little bit misleading?
No, actually, we calculate. we are.
Well,
I'd say we are the most highly regulated organization probably in this country.
Well, I would disagree with that, but let me ask you.
But we're very transparent about our numbers.
I've got this for one of your affiliates. Will you provide this same kind of documentation for all your affiliates to this committee?
I believe we actually already have.
No, you haven't.
Well, I'm happy to speak to the chairman because we have.
This is the only one that had it. Will you today, yes or no, provide this for all your affiliates?
We've produced all 990. Okay, well, we just have a disagreement of opinion, and I'm happy to talk to the
it's not a disagreement. Will you provide the number of
We've already
revenue?
Provided the 990s for all of our affiliates, and so that's
but it didn't outline it like this.
Well, maybe perhaps.
So are you saying that you don't keep track of it?
You said that. I did not say that.
No, I'm asking you. Do you keep track of it?
Every single affiliate in Planned Parenthood meets with all the laws and regulations, and they file their 990s. And
that's a great answer to a question I didn't ask.
We've provided.
Would you provide it to this committee?
I don't exactly know what it is, since I've said to you
okay, well,
repeatedly,
I'll tell you what
we've provided the 990s.
The revenue that Planned Parenthood derives from abortions.
You've got these high-paid executives. There's, interestingly enough, 44 of your highest-paid executives make more than any cabinet member. 28 of them make more than any member of the cabinet. You got that's over 200,000. You got another 11 make over 300,000. That's more than anybody in the cabinet, any Supreme Court justice, the Chief Justice, the Vice President. And you've got 4 that make more than the president, not counting you. Are any of them expected to make political contributions?
By who? I'm sorry.
By you.
No.
Do you direct political contributions to candidates?
The PAC does.
Yes, but do you have any input in who gets?
No, but there is a PAC committee that votes on it.
Are you on that PAC committee?
I'm trying to respond.
Are you on that PAC committee?
I'm not on the PAC committee.
Do you have any input into who gets political contributions?
No, the PAC committee votes on who gets political contributions.
So there's no collaboration between you and the PAC committee? You're saying
I haven't sat on a PAC committee meeting for a long time.
All right, let me ask.
Your
PAC
we operate
absolutely.
We meet the federal laws and restrictions.
I appreciate
remaining to the chairman. Ms. Richards, Peter Welch sits right down there on the other side. He's a gentleman from Vermont who's a Democrat. Peter and I do not agree on very many issues, but there's not a more well-regarded member of our body, I don't think, and he evidenced that today by making it crystal clear that he makes an effort to understand both the analysis and the conclusions of those who may have a different position from the one that he holds. Do you understand how some of us may, at a base level, disagree with you on the origin of life? Do you make that same effort to understand that my friend from Vermont, Peter Welch, makes?
I fully respect, and I think I spoke to this in my opening statement with the chairman, that I understand people have different feelings about whether abortion should be legal in this country or not. I think it is important that it is legal, and we can disagree. And I know thinking people disagree about abortion, and our goal at Planned Parenthood is to be judgment-free and to allow people, and women in particular, to make their own decisions about their pregnancies.
We're going to get to the judgment-free zone here in just a second, but you mentioned abortion. How about partial birth abortion? Do you understand how some of us may support a ban on partial birth abortion?
Excuse me?
What if someone can't pay for the abortion?
We raise private dollars to try to help women who cannot afford abortion services if they choose that they want an abortion and they can't afford it. We try to raise money to help supplement the cost of an abortion.
Only through private donations. Do you make up the difference, is what you're saying?
Well, I don't, but our 59 affiliates have a variety of what.
Does Planned Parenthood make a profit or make money on reimbursement of Medicaid services?
We don't make a profit on anything, but in terms of Medicaid.
Well, it depends on how you,
Okay,
you have 127 million
let's talk about
excess dollars
Medicaid's
every
very
year.
easy. Yeah, Medicaid's very easy. Medicaid reimburses, and as you know, across the country, Medicaid rates vary widely. In some states, they come closer to paying for the cost of the services. In a lot of states, we actually have to raise private donations to supplement what it costs for.
So you may make money on some Medicaid reimbursement services, correct?
I don't know that anyone does, but I'd be happy to find out.
And I'm sure you're well aware it's against federal law to use taxpayer funds for abortions, except for rape,
abundantly
incest,
clear on
and life of the mother.
and
So
we're
are
heavily
you-
regulated as HHS regulates.
Are you saying
Medicaid
today with 100% surety that not one dime of taxpayer money is used to provide abortions?
what I said earlier?
I mean, yes or no? 100% surety?
No, because
Because
actually
that is against the law.
the federal law allows for federal dollars to pay for abortion services in very rare instances.
Correct. So
Rape,
other than those
incest,
instances.
and the life of the mother. We don't use any federal dollars for any abortion services except for those that are
What about the profits generated
permitted
from
by
those federal
law.
dollars? Are any of those used to cover abortion services?
Sorry, we were kind of talking over yourself. You have to repeat it. I just didn't hear
The
you.
profits generated from taxpayer-funded sources such as Medicaid reimbursements, are any of those profits
I don't
used
believe-
to help cover the costs of abortions?
No. And I don't believe there, I will absolutely, we can go through all of our 990s, happy to go through with the committee, but I don't believe there are any profits from any Medicaid services in this. Deny the ability to go to Planned
Reclaiming my
Parenthood,
time.
390.
Reclaiming my time, you said it would block access. It would block access. Now,
For our patients, it
yes
would
or no,
block
Ms.
that.
Richards, do you acknowledge that community health centers outnumber Planned Parenthood clinics by roughly 20 to 1?
I don't know the exact number. I know there's more community health centers than there are Planned Parenthood.
So you will acknowledge that they outnumber Planned Parenthood clinics?
I'm happy to acknowledge that.
Okay. And yes or no, Ms. Richards, do you acknowledge that these facilities funded under my bill provide a broader range? These facilities actually provide a broader range of services than what is offered at Planned Parenthood, for instance, mammograms?
I'm not an expert on what all community health centers provide. I know we work in close collaboration with them, and in fact, often they send us their patients that they can't see for birth control.
But you will acknowledge that you do not provide mammograms, which was acknowledged in this committee today.
We've never made any.
So that would say that they do actually provide more extensive services than what you provide there at Planned Parenthood.
I don't know,
So-
what I said to you, though, is I don't know what all the community health centers provide. We're very clear about what we do provide at Planned Parenthood and about the number of women who voluntarily choose to come to
So
us
reclaiming
because
my
of our
time
care.
again, because I have just a very short period of time. So knowing that the House passed bill actually increases public health funding and redirects those federal dollars to clinics that offer more preventative health care than Planned Parenthood, you can't substantiate your claim that the bill blocks access to care. It does not block access to care. Now, I do want to just end this
just
by
think we
saying
disagree.
that you had a statement that you made that quality, affordable health care is your entire mission, and you made that statement, I actually wrote it down when you made it, why would you not make an executive decision then to temporarily discontinue your abortion services, which only represents, by your testimony, 3% of the services that you provide, and continue providing what you consider to be your entire mission of 97% of the services provided?
Well, because abortion is a legal service in America.
But
And we think it's important that women, you quoted me as saying quality, affordable health care, and that includes access to quality and affordable abortion services as well.
But you acknowledge that, do you say abortion is health care? Do you consider that health
Yes,
care?
it's a health care service for women. In fact, 3 in 10 women in this country have accessed an abortion
So you
at some
define
point.
health care, abortion as health care?
It absolutely is part of women's health care, and women will tell, I think women would agree.
Are you aware of a report that just came out today that has been released by Coal Fire that shows in their report, and they say the forensic analysis removes any doubt that the full-length undercover videos released by the Center for Medical Progress are authentic and have not been manipulated. Analysis scrutinized every second of the video recorded. I would say if you were to compare the two companies now that have done this investigation, you see Coal Fire has reported on every second of those released audio and video investigation footage, as opposed to the Fusion report, which only had 4 full-length videos. So I think this discussion, Mr. Chairman, is still yet to be had about just what these videos do show and the fact that they perhaps, coming from Fusion, are not doctored. Thank you, Mr. Chairman. I yield back.
I thank the